Hello, my name is Joseph Mitchell, and this is my research proposal for Health Science 694, Research Design and Methodology. The topic of my research proposal will be military PTSD, barriers to treatment and prevention. So I'd just like to start by giving you a little bit of background. Chronic stress and other severe mental health disorders associated with stress are widespread problems in the United States. Consequences of chronic stress and stress-related disorders include greater risk for several physiological health conditions such as heart disease, hypertension, respiratory illnesses, viral infections, and several other chronic diseases. Research has indicated that intrusive stressful thoughts can lead to symptoms of anxiety and anger, resulting in an overall decreased quality of life. This is particularly true for individuals who are affected by post-traumatic stress disorder. PTSD, or post-traumatic stress disorder, is a severe stress-related condition which is often the result of direct involvement or observations of grave and occasionally lethal experiences in which the observer feels helpless and fear regarding the situation at hand. Risk factors for PTSD include prior trauma, acute stress disorder, lack of social support, hyperarousal, and a variety of personal and environmental factors. Amongst those that are at greatest risk for developing PTSD are the current and former members of the United States Armed Forces. The United States Department of Veterans Affairs reports that the slight increase in traumatic experiences amongst the male population specifically of veterans can be attributed to the fact that generally men have high exposure to incidences, to accidents, physical assault, combat, and other paths leading to death or even injury. Some of the contributing factors to PTSD, while trauma has been determined as being the primary etiological factor in PTSD diagnosis, research data indicates that personal, family, and social environment has a profound effect on the expression of PTSD. Also, interpersonal style, mainstream discrimination practices, group marginalization, and lack of social support and private family chaos also play a role. Ultimately, a stressor or trauma that elicits a psychological break is eventually what leads to the manifestation of PTSD. Development of the pathological response still kind of remains a mystery to clinicians. I'd like to talk a little bit about combat neurosis. Combat neurosis is prevalent among many armed forces veterans. Combat neurosis describes any personality disturbance that represents a response to the stress of war. Closely related to post-traumatic stress disorder, and it's closely related, and it usually is used synonymously or interchangeably with PTSD. Symptoms of the disturbance may appear during the battle itself, or may even appear days, weeks, or months, or even years later. Diagnosis and treatment has become a focal point of research among the public sector as well as the medical community. Symptoms include mild anxiety, insomnia, depression, memory loss, withdrawal, maybe emotional indifference, and self-endangering behaviors. So here's the statement of the problem. As of 2016, approximately 292,006 civilian veterans over the age of 18 were residing in Los Angeles County. Approximately 7% of the total population of veterans are between the ages of 20 to 35 years of age. The physical and psychiatric health, as well as the general overall quality of life of U.S. veterans, is deteriorating and at substantially greater rates than the general population. In particular, millennial veterans are not pursuing mental health treatment for one reason or another. Reasons may include, but aren't limited to, embarrassment, shame, fear, stigma, access to care, lack of resources, or other demographic factors and other false perceptions. And here's my statement of my research topic. Studies conducted by the United States Bureau of Veterans Affairs and the National Centers for PTSD have determined intervention and education regarding stress coping mechanisms after exposure to trauma to be the best practice of decreasing the risk of development of PTSD or other related health conditions. My proposed research will serve to identify millennial veterans who have served in Afghanistan, Operation Enduring Freedom, Operation Iraqi Freedom, or current military campaigns. Candidates will be assessed for exposure to trauma and the presence of mental health issues. My priority population will be male veterans between the ages of 20 to 35 years of age residing in the San Fernando Valley who were previously or continue to be on active duty in the United States Armed Forces at some point between the years of 2001 and present date 2018. Data will be used to identify obstacles and barriers to veterans seeking mental health treatment and the development of more effective intervention strategies pertaining to diagnosis, retention, and also linkage to care. Rationale and justification. Chronic stress and PTSD research was conducted on 1,938 military members who served in Operation Enduring Freedom and Operation Iraqi Freedom. The prevalence of current PTSD was 13.8% as compared to only 78% of PTSD cases amongst the U.S. population. There's also a mental health and substance abuse link. According to the National Institute of Drug Abuse, there's a correlation between drug abuse and combat exposure, in which many veterans, specifically millennial veterans, are experiencing. 25% of Operation Enduring Freedom or Operation Iraqi Freedom veterans show signs of a substance abuse disorder. PTSD literature review. The American Psychiatric Association has outlined the basic criteria used to diagnose PTSD in its Diagnostic and Statistical Manual of Mental Disorders. As a whole, PTSD has been studied for over 100 years. A comprehensive etiological model has been developed which incorporates both medical and psychological research, but that had not been developed until the turn of the century. Essentially, there are three causal pathways which facilitate, or which they believe facilitate, the development of PTSD. These pathways are residual stress, ecological factors, and biological factors. These pathways illuminate how PTSD might develop and what populations might be at a higher risk for developing the disorder. Ecological risk factors are linked to an individual's self and surrounding environment. Variables include developmental history, an individual's coping mechanisms, and vicariously learning and interpersonal support systems. Accumulated psychosocial effects caused by previous traumatic experiences may cause an individual to respond to subsequent traumatic events in an adverse manner. So more of a residual effect. Trauma has been determined to be the primary etiological factor or cause in PTSD diagnosis. Family, personal, and the social environment has a profound effect on the expression of PTSD as well. Methodology. For my research, my proposal is to use an explanatory sequential mixed methods approach. Quantitative methods will be used to identify the following amongst the sample population. I'd like to identify mental health symptoms of individuals, their utilization of mental health services, and the number and type of traumatic experiences that the individuals may have been exposed to. Qualitative methods will be used to gather data pertaining to participants' knowledge, attitudes, and beliefs regarding mental health. Qualitative methods will consist of patient observation, structured interviews, focus groups, and also self-report questionnaires, which may incorporate individual outlying factors that may not be identified, may not have been identified previously. These methods will help aid in initial diagnosis, assessment, and severity, and also help to differentiate between acute and chronic PTSD. Acute PTSD is an individual having symptoms for less than 3 months after the traumatic event has occurred. In chronic PTSD, symptoms are pervasive for more than 3 months after exposure to the initial trauma. As I stated previously, symptoms can include but are not limited to avoidance, negative cognitions, aggressive, self-destructive behavior, sleep disturbances, and also hypervigilance. Veterans with a past or pending diagnosis of PTSD will be invited to participate in a year-long research study that will serve to explore barriers to identification, retention, and treatment of the disorder. The sample population of participants will be drawn from a pool of individuals who are patients at VA Sepulveda Ambulatory Care Center located at 16111 Plummer Street, North Hills, which is very close to the Cal State Northridge campus. Areas of concentration will include access to care, availability of mental health services, and also the education and hopefully the eradication of the social stigma surrounding mental health services. So in conclusion, I'd just like to say I'd just like to give a thanks to our troops who have done so much to protect us, protect our freedom in our country. And I just say we should reciprocate that by supporting our troops in their war against fighting PTSD. Thank you very much.